Okay, once again, welcome everybody to join today's Building Better Caregiver Session 0 class. So today, just want to start off with some background. This class is provided by CCACC Health Center. We are at Gaithersburg, Maryland. We are a safety net clinic, provide medical care and mental health, rehabilitation service, as well as a lot of community health program. So this is the way to get in touch with us. You can go to our website, ccacchealth.org, or you can subscribe to our YouTube channel. We have a lot of recording on health talk and health information. So if you would like to review those talks, you can go to our YouTube channel and have a look. And also on every Wednesday, we send out a new e-newsletter with MailChimp. This is the link. You can sign up so that you will keep updated about the service we provided. We send out information every Wednesday. So like I said, we are a safety net clinic. We provide one-stop, all-rounded service to the insured and uninsured community members. We provide primary care, mental health, rehab, a lot of community outreach service. And we also have a mental health 360 program. Maybe I can play. Let me see whether I can play a little 3 minutes, 2 minutes clips so that you kind of know that mental health service that we provided.
With the growing concern for mental health and increasing need for mental health services, understanding mental health is becoming more and more important. Established in 2015, CCACC Health's Mental Health 360 project aims to raise awareness of mental health needs among the Asian American population, provide mental health services, and serve as a platform to gather resources from the community and local governments. This project was initiated by a group of community doctors, local government officials, and communication advocates who were concerned about the overall well-being of the Asian community. We have hosted a series of seminars and workshops to raise awareness and educate the public, addressing the stigma often associated with seeking psychological support. From the Hear Me Out event that promoted communication between first-generation immigrant parents with their second-generation American-born children, to our recent youth mental health first aid training, we strive towards engaging the community to be part of the solution to the mental health crisis. We have also worked with other community providers to discuss our multidisciplinary efforts in providing services for seniors with dementia and their family. We provide psychiatric services and counseling, particularly serving patients who have limited access to mental health resources due to language barriers, cultural differences, and financial constraints. We have a psychiatrist, a psychiatric nurse practitioner who can provide medication, a psychologist who specializes in working with youth.
Sorry, I was trying to admit someone.
Multidisciplinary, particularly serving patients who have limited access to mental health resources due to language barriers, cultural differences, and financial constraints. We have a psychiatrist, a psychiatric nurse practitioner who can provide medication, a psychologist who specializes in working with youth, and a licensed clinical social worker who can work with adults from a family and environmental perspective. We take a solution-focused approach and provide treatment referrals to specialists as needed. Our different programs target different needs. The Integrated Chronic Care Management Program provides one-on-one coaching for depressed patients who suffer from more than 3 chronic diseases, working to identify obstacles in disease management. The program to encourage active and rewarding lives serves depressed and socially isolated seniors, addressing barriers to healthy living. The Village program provides resources and support for families caring for loved ones with dementia or children with special needs. The Chronic Disease Management Workshops works with community members who suffer from chronic conditions, helping them gain an overview of their health, engage in new health practices, and address psychological factors. As an advocate for the Asian community, we've received support from Montgomery County and the Maryland Community Health Resource Commission. Each year, we host 3 to 4 large-scale lectures with topics covering depression, anxiety, and other common mental health issues. We've provided mental health services to over 100 community members, and we've promoted communication between immigrant families to help prevent and reduce depression and suicide among the youth population. We will continue to shine a light in this community, provide services to community members, and promote overall well-being of the Asian American community.
Okay. Thank you, and sorry for the technological hiccup along the way. But so just the video just give you some idea on the mental health service that we provided. So let's go to the next. Okay, so for today's class, so I also want to tell you that we do provide some clinical support for patient and the family with dementia patient. So of course we provide medical care. Like I said, we provide primary care and chronic disease management. So if your loved one, dementia loved one, have the need to see a doctor, we are happy to help out. And we have a neurologist who can provide neurological consultation if you want to kind of get a more better idea on your loved one's condition. And then we have psychiatric consultation if your family member has some behavior issue or mood issue. Maybe we can consult the psychiatrist for some medication management. And we also have therapists to provide family and caregiver counseling and ongoing support. We have occupational therapy to help the patient to regain some daily living function, such as buttoning up the clothes, or sometimes patients have some issue with using their hand, and of course, memory problem. Our occupational therapy can provide training and hopefully to maintain or even improve a little bit the daily function. So of course, today you are here to join our Building Better Caregiver Workshop. I'll talk about the layout in a little bit. And we are planning to have support group for caregivers. Hopefully, we can set that up soon. We are still in development of this service. And we do, CCACC do provide adult daycare center. So we do have some daycare participants who are dementia and the loved one to use the daycare service so the caregiver can have a break. We also have home care service to provide daily living assistance. So if you're interested, reach out to us. So today's workshop is Building Better Caregivers. So, you know, the main focus is to support caregivers instead of giving you a lot of the textbook information on dementia. So just want to point that out. And this is an example of every class we touch upon different topics. So we have 6 sessions in total, and so Each session has several 6 to 8 activities built in. And we talked about how to gain relaxation skill, tools to improve fatigue, understand challenging behavior from our care partners. Our care partner would be the one that we care for, and also to make it understand it's our loved one who suffer dementia or other hard to care for kind of condition. And a very important part is action planning, and we have this every single session. So just for the participant to think about something they want to do, and then they need a little bit nudge, a little bit support from our peer participant to carry out the action plan. So caregiver can practice healthy activity or healthy practice to make ourselves a better care provider, caregiver. Okay, so also we will introduce the different tools in each session so that we achieve the goal that we just mentioned, to be more solid and a sound and healthy caregiver so that we can support our care partner, our loved one. Okay, so this is a series of 6-week session, 2.5 hours each. And we ask you to help us to fill out the pre and post questionnaires. It's the same set of questionnaire. So our our funder, Living Well Center of Excellence, and actually more higher organization, a nationwide organization, they want to know whether this session is helpful. So please help us to fill out the pre and post form. It's not too complicated. I think it's just a page and a half. And also, we will do a lottery drawing for participant who complete the whole class. So this is, and I'm lying here, it's a $25 gift card for 4 participants who complete the whole session. So that we will find out the 4 lucky participants, and then we will mail out $25 Amazon gift card so that the caregiver can buy something for yourself, to kind of like be more happy and healthy. So the other incentive we provide is actually from Living Well Center of Excellence. So once you complete the 6th session of this class, if you are also a caregiver for a main caregiver for your dementia loved one, and you don't receive any subsidy for the care, you are eligible to apply for this allowance, and it will be up to $800 for respite care to recruit respite care. So these are the all the information that you need to fill out in order to receive the support. So just give you some ideas, a 6 form to fill out. Okay, so that's all I want to share with you. And the rest of the time, I'll give it to Yu Xin and Heidi. They'll lead you through the session 0 contents of this class.
Hi, everyone. Welcome in our section 0, dementia. And so dementia, it's not a normal part of aging. It's a general or umbrella terms that describe a group of symptoms characterized by a decline in cognitions, including memories, language, and problem solving, or other thinking skills that affected to a person's abilities to perform activities of daily livings. And also eventually, eventually for the ability to carry out the instrumental activities of daily livings. Changes may also affect for behavior, feelings, and relationships. For example, that someone who is usually very calm and soft-spoken may react with anger. Next. So we talk about activities of daily livings that we do every day in our self-care, such as bathing, dressing, eating, grooming, toileting, and mobilities. Next. So the instrumental activities, daily livings, also called as IADLS, so require of the greater executive functions, more thinking and processing. So for example, including managing your finance, handling transportations, being able to shop, use the telephone, prepare meals, and do housework. So you can see the differences between the activities of daily livings and also the instrumental activities of daily livings. So the IADLS is more ability for processing the information. Next. So dementia, it's caused by damaging to the brain cells. It interferes with the ability of the brain cells to communicate normally. So the brains consists of many nerve cells that carry messages and communicate with the other cells. So different type of the dementia are associated with the particular type of the brain cells damaging. Next. So other conditions that may contribute to cognitive decline. It is important to know that the cognitive decline or changes can also be impacted by causes, medical and psychological conditions. It is important to consider that when a changes is noted. So the medical conditions that can affect cognitive functions, including vitamin deficiency, hypothyroidisms, deliriums, the acute confusions, and also medications based on the side effects and also the drug-to-drug interreactions. And also have the psychological conditions, such as the depressions and stress can be contribute to decline in the cognitive functions. Next. So here is a little brainstorms that we have. So what would you do if you suspect someone was having some cognitive decline or changes? So perhaps that you saw your 94 years old neighbors looking unkept and not her usual self, and she was outside at midnight, wandering at the neighborhood. So anybody think that have ideas to help out your neighbors? So for mine, I will say like I will go ask her if she need any help. Anybody has?
Yeah, I
Yes.
would probably just if she's not living alone, then I will knock on the door and get the whoever is living with her and help her.
Okay. Anyone has idea?
Maybe to see whether she carry any ID, I mean personal identification card or anything to contact her family, maybe.
Okay.
Okay.
Mm.
So I guess this is an
So
example of how the class engage everybody in discussion. It's just it will have like setting like this. So please feel free to share your idea, what your contribution of your thoughts would help to make this session going.
yeah, if you're not comfortable or willing to speak up, you can also type it in the chat box, and then we will be also put it into the box that we will be filling in.
Mhm.
Yes, I think that if we see that elderly out there, I mean, I guess, we want to keep an eye on that elderly. I mean, if we need to go to knock on her house door, I mean, we don't want to lose her when we were going, towards the house. So somehow it's good to have two people, one person keep an eye or just, engage her in talking, and then the other person, knock on the door, to find her family.
But frankly, who would be outside in the midnight looking for
To witness
people?
this.
It's like it's probably a rare case.
It's very case, yeah. I would say it doesn't really matter midnight or not, right?
Yeah, but during the daytime, I would definitely say, you can easily get some help from,
Yeah.
your neighbor and, whoever walking by, and there's probably be a much better chance to help in that case.
Okay. So should we take like this, or do you want a couple more, or it's good?
That's good.
Okay. So so this is like, as Kate said, this is our one of type that we will be perform in the later throughout our the workshops. And then it's also that it is a here is some answers from us. It's like, go ask her if she's needed any help, and or knock on the door and get whoever is living with her, and check if she has ID so that you can contact her families and keep an eye on her. So good to have two people try to engage with her and contact her family. So these are all the good ideas for how to keep this person's company. So also it is a visual to discuss changes with the person's primary care provider as well, so they can determine the causes of declining in a cognitive function and design if it is related to the medical or psychological conditions or possibility dementia. Next. So diagnosis of dementia. So there is no one can test to diagnose dementia. The diagnosis is made by the primary care provider, such as general medicine doctor, or if they see a geriatrician doctors who carry of the older adults, or sometimes may be referred to a specialist dealing with the memories as such as the geriatricians and psychiatrists, or even neurologists as well. So diagnosis is based on careful medical history, including the psychiatrist history, physical and neurologist examinations, laboratory tests, or informations from family or caregivers, including the cognitive or behavioral changes they have to observe. So sometimes providers may diagnose dementia but are not able to specify the type of dementia because the symptoms and the brain changes on the different dementias may overlap. Next. Mild cognitive impairments. So most form of the dementia comes on slowly and may be preceded by the mild cognitive impairments, also called MCI. So the term of the mild cognitive impairments represented a condition in between normal aging and dementia, in which persons have notable problems with the memories or other core of brain functions. But these impairments are not specific to interfere with the daily life. So the person's affect and family member do notice the cognitive changes. So it takes like approximately 15 to 20 of the people ages 65 and older have the mild cognitive impairments. So people living with the mild cognitive impairments more likely to develop Alzheimer's disease or other dementias that someone's without the mild cognitive impairments. So however, the mild cognitive impairments does not always lead to the Alzheimer's disease. It is important to have a medical evaluations and follow up with the evaluate changes in symptoms. Next. So everyone ages differently. It is important to remember everyone ages differently. One 80 years old, it's not the same as others 80 years old. Some factors that may affect old adults' abilities to carry out their activities of daily livings and also the instrumental activities of daily livings may be a chronic medical condition such as arthritis. So they may experience some vision difficulties such as the cataracts or have difficulties with the high-pitched sounds as well. Next. So the for the Alzheimer's disease and the vascular dementia, today we will be discussing of two most common causes of dementia. Alzheimer's disease, the most common cause of the dementia, and the vascular dementia, the second most common causes of the dementia. So there are other forms of dementia, such as the Lewy bodies and also the frontotemporal dementia, which we will not be addressed today. But we can refer you to go to the Alzheimer's website to be reviewed for these more deeply. So the exact cause of the Alzheimer's disease is not yet known, but there is high level of the certain proteins that make it hard for the brain cells to stay healthy. It leads to nerve cell death and tissues loss throughout the brain, causes a slow decline in the memories and thinkings and the reasoning skills. So Yushin will be present you more information for our PowerPoint. Yeah, thank you.
Okay, so I'm going to talk about the risk factors. So these include advancing age, physical inactivity, high cholesterol, hypertension, diabetes, smoking, and obesity. So on average, a person lives 4 to 8 years after diagnosis, but can live as long as 20 years depending on the individual. Next slide, please. So we have a brainstorm here. So what are some lifestyle changes you can make to lower your risk of developing an Alzheimer's disease?
Still weight. Do some exercise.
Yes, so lose weight and do exercise.
Yeah. Drink more water.
And drink more water.
Yeah, make yourself hydrated.
Make yourself hydrated.
Good sleeping.
Oh yeah, sleeping is very, very important.
And good sleep. What else?
Health diet.
Healthy diet.
Yeah.
Have good friends.
Making friends.
Yeah.
Have a good friend.
Exercising.
Right. Exercise.
Reading and learning new things.
Reading and learning new things. Okay, so I'm going to repeat the ideas you gather here. So lose weight and do exercise, drink more water and make yourself hydrated, having a good sleep, healthy diet, having a good friend, exercising, reading and learning new things. So yes, so all these things can lower your risk of developing an Alzheimer's. You can go to the next slide, please. So there's one more thing that you didn't mention about. So about like don't smoke, avoiding excessive alcohol intake, keeping up with social engagement, and keeping your blood pressure and glucose in control. And remember to stimulating your brain with activities. These can all lower your risk of developing Alzheimer's. And current research suggests that healthy aging may help with brain health and reduce the risk of Alzheimer's disease. Next slide, please. So I'm going to talk about the 10 warning signs of Alzheimer's. So you can refer to Alzheimer's website for the 10 warning signs of Alzheimer's disease and more details, but these are described in more there are more details described in their website, but I'm going to talk about in brief today. So the first one is memory loss that disrupts daily life. One of the most common signs of Alzheimer's disease, especially in the early stage, is forgetting recently learned information. Others include forgetting important dates or events, asking the same questions over and over again, and increasingly needing to rely on memory aids like reminder notes or electronic devices or family members for things they used to handle on their own. And the second one is challenges in planning or solving problems. So some people living with dementia may experience changes in their ability to develop and follow a plan or work with numbers. They may have trouble following a familiar recipe or keeping track of their monthly bills. They may have difficulty concentrating and take much longer to do things than they did before. And the third one is difficulty completing familiar tasks. So people with Alzheimer's often find it hard to complete daily tasks. Sometimes they may have trouble driving to a familiar location, organizing a grocery list, or remembering the rules of a favorite game. And they may also have the confusion with time or place. People living with Alzheimer's can lose track of dates, seasons, and the passage of time. They may have trouble understanding something if it is not happening immediately. Sometimes they may forget where they are or how they got there. And trouble understanding visual images and spatial relationships. So for some people, having vision problems is a sign of Alzheimer's. This may lead to difficulty with balance or trouble reading. They may also have problems judging distance and determining color or contrast, causing issues with driving. And new problems with words in speaking or writing. So people living with Alzheimer's may have trouble following or joining a conversation, and they may stop in the middle of a conversation and have no idea how to continue, or they may repeat themselves, and they may struggle with vocabulary, have trouble naming a familiar object, or use the wrong name, such as calling a watch a hand clock, and misplacing things and losing the ability to retrace steps. A person living with Alzheimer's disease may put things in unusual places. They may lose things and be unable to go back over their steps to find them again, and they may accuse others of stealing, especially as the disease progresses. And decrease or poor judgment. Individuals may experience changes in judgment or decision making. For example, they may use poor judgment when dealing with money or pay less attention to grooming or keeping themselves clean, and withdraw from work or social activities. A person living with Alzheimer's disease may experience changes in the ability to hold or follow a conversation. As a result, he or she may withdraw from hobbies, social activities, or other engagements. They may have trouble keeping up with a favorite team or activity. Changes in mood or personality. So individuals living with Alzheimer's may experience mood or personality changes. They can become confused, suspicious, depressed, fearful, or anxious. They may be easily upset at home with friends or when out of their comfort zone. Next slide, please. So 3 stages of Alzheimer's disease. So we have early, mild, and late. Symptoms worsen over time and the rate of progression varies with each person. So in the early stage, people may still function independently, but they or close ones may notice memory lapse, such as forgetting familiar words or the location of everyday objects. And next slide, please. So middle stage. Middle stage is typically the longest stage and can last for many years. As the disease progresses, people will need more assistance with care. In addition, symptoms may include an increase in confusion, forgetfulness, wandering, and personality and behavior changes. The person may not be able to identify an appropriate object to utilize for a task. So an example is if you ask them to brush their teeth and they ended up pick up a hairbrush. In late stage, the person loses the ability to respond to their environment or to carry on a conversation and eventually control movement, which requires total daily care. So the person living with Alzheimer's may not be able to initiate engagement as much during the late stage, but he or she can still benefit from interaction appropriate, like listening to relaxing music or receiving reassurance through gentle touch. So remember, every person is different and his or her progression through stages varies and may overlap. And next slide, please. So vascular dementia. The second most common cause of dementia is vascular dementia, So it represents approximately 5 to 10% of cases. So vascular dementia usually results from a blockage or reduction of blood flow or microscopic bleeding in the brain. This usually results from a stroke or a series of strokes that deprives brain cells of oxygen and nutrition. The impact on thinking varies depending on the severity of the blood vessel damage and the part of the brain it affects. Next slide, please. So here are some care tips. If you're providing care to a person with dementia, remember that routine is their friend. Try to keep their daily routine schedule with ADLs, such as meals, dressing, bathing, and other activities you do. Incorporating their past habits makes it more personal. So for example, if they bath in the morning or in the evening, to make it more personalized. And remember that you want to involve them, but not overwhelm them. So for example, you can ask them which outfit they want to wear today. So you can give them 2 outfits for them to pick from, but not the whole entire closet. And you need to allow them some rest periods, but not naps in between activities, and incorporate activities that are within their ability to do. If the activity is too challenging, it may cause them to become frustrated, and we don't want that to happen. So as the caregiver, you play an important role. The person you're caring for may often respond based on your voice tone, as well as your response or reactions to them. So maintaining a calm, reassuring voice and response to their behaviors is important. Next slide. So behaviors and psychological symptoms. So a serious consequence of dementia involves behavior and some other psychological symptoms. Some examples of this include that they may think a family member is taking their possessions, or they become insistent on going home when they are home, and you cannot convince them otherwise. They may become tearful, and you will not be able to consult them. So these behaviors may become particularly concerning and distressful to families and caregivers. It is important to establish a partnership with the primary care provider and team, the Alzheimer's Association, and connect to other community resources. Next slide. So here are some resources you can find. So Maryland Access Point, it is a statewide resource for information and assistance about long-term services and supports to allow individuals to remain at home and plan for future needs. And 211 Maryland is a partnership of 4 agencies working together to provide simple and easy access to health and human services information. And AARP, National Caregiving Foundation, they will have some free toolkit for caregivers. And Maryland Living Well Center of Excellence, they have many like caregiver programs like our program Building Better Caregivers and powerful tools for caregiver. And there's another program called Savvy Caregivers. So we also have Mental Health Association of Maryland. So you can find mental health in some guidebook for older Marylanders and the people who care for them. And the Alzheimer's Association, they have a 24/7 helpline and many information. I will copy their the URL links in the chat box, and if you have time, you're welcome to go over the list. And that will be all.